Welcome to the Wellness Surge podcast with Dr. Adiola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Surge podcast. My name is Dr. Adiola Oke. I am your host for today, and I have with me the wonderful Dayo Adeyemo. So say hello to everybody, all right?
Hi, everyone. Excited to be here.
Awesome. And so today we're going to talk about how you can thrive with this pandemic of loneliness. So let me give you a little bit bio about Dayo Adeyemo. She's a US-based board-certified psychiatric mental health nurse practitioner and an advocate who trained both in Africa and in the United States, and has almost 15 years of nursing and public health experience. That's good. She is a mental health, stress management, and productivity expert. She helps local and international organizations, businesses, NGOs, schools, and government departments, groups, and individuals improve the mental wellness of their leaders. We all need that. She also helps teams, employees, and partners, as well as help them with their productivity. She has had the privilege to travel to many countries in Africa, Europe, North America for various public health organization facilitations and trainings. So thank you for coming on the show. We're really pleased to have you here today.
Thanks for having me.
Yeah, we're going to be discussing a really important topic. We keep talking pandemic, but what is this pandemic doing to us? And what loneliness is it bringing into our lives, right? So as a mental health provider, what are you noticing more frequently during this pandemic compared to before the pandemic came up when it comes to people's mental health?
So that question, I'd like to answer it, but first, let's define the audience, or let's define the group we're talking about. And I think generally, globally, we can divide ourselves into four parts. The first group will be the group of those whom the pandemic had affected their employment status, their job, their businesses in a negative way. Say some people, right? A lot of people lost their job already. A lot of people, their business had to close down. A lot of people are pivoting. There's so many things going on. So that's the first group. The second group is a group of those that they still have their job, they still have their roles, but their responsibilities already increased a lot. We have, those who are, organizations that are still thriving. We have the policymakers, working on getting things straightened out. We have those that they now have to just work from home. They still have their job, but everything is changing even within the system. It's not what it used to be. And we have the frontline workers, those whom they're taking this pandemic issue. They're the ones that they're taking care of the sick people. They have to go to work. They have to take care of those people. Not just that they have their jobs, for them, their risk of contracting this COVID-19 is higher than that of any other person. And at the same time, they're that one person, but they still have their family. They either have a husband or a wife that lost a job, or a husband or a wife that is now working at home, and they have to be going out to take care of people and come back. And the fourth group is a group of others, the children. We just said something about the children now. We have elderly people in long-term nursing homes. We have the teenagers. These ones are not necessarily working or not, but they are also affected in their own little ways. So what have we been seeing, regardless of the group you are, even though there's specific issues that we all have, but the common thing is that there's been an increase in anxiety and depression. It might be based for different reasons or different things that you're going through, but there's been a huge increase in anxiety for everyone. And there's been, depression is also on the rise. But as much as we're seeing this, another fortunate thing is that this pandemic has brought a lot of attention to mental health. So as people are experiencing this, stressful time, and they're realizing stuff going on with them mentally, how they're having to cope with whatever group you belong to. They're having to deal with different issues, and it's on the rise everywhere. And now we're talking about mental health everywhere. In the news you hear mental health, in churches, everybody's talking about their mental health, because now it's real than ever. That's what I'm seeing as a mental health professional.
I think it's like a blessing in disguise, right? Before, mental health was like more of like, oh, don't talk about mental health, blah, 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 some stigma associated with it. So right now, people feel more comfortable, right? Is that what it like seems more comfortable discussing it? Because it is a part of our living, and there should be a balance between the physical and the mental. So if you cannot talk about mental health in the past, and now we're kind of being able to talk about it, I think that's good. Even though, right, there's still the
Yes.
anxiety, there's the depression, but there are people like you for that, right? Okay.
Yes. Another thing is, it's a blessing in disguise, and a lot of issues coming up as it affects mental health issues, it affects our relationships, directly at work, at home, even our personal relationship with ourselves. And now with that, as everything is coming up, with the depression, with the anxiety, we're seeing a lot of people having to cope in different ways. We're seeing domestic violence on the increase. We're seeing substance use on the increase. We're seeing a lot of ways that people are coping, or that is not necessarily unhealthy. And then a lot of issues are now coming up, like those that are dealing with, there's been issues that they're not talking about, but now everything is escalating, and they're now lashing out on the children or their spouses, and it's bringing all this issue to light. And everybody is now kind of coming together to say, hey, mental health issue, even though it's so stigmatized, and everybody's busy doing their own thing, that we're not focusing on it, but here it is staring us in the face, and we're having to deal with it. So, like you said, it's a balance. For me, as a mental health advocate, unfortunately, the attention gets on mental health when there's, I call it, violence-induced attention. It doesn't have to be that. But now that it's coming up, it's not, no other person had to die. It's Suicide Prevention Month right now. No other woman has to die from violence and stuff. So it's bringing everything all together as we're having the issues escalate on a personal, individual level.
Yeah, I actually worried a lot about when the pandemic hit and people could not leave their houses. I actually, like my family and my mom were like, what about all these kids that they are being abused at home? They can't leave. There's nowhere for them to escape to. What about those women that they're being abused, that they used to run away to somebody's house? How are they dealing with this? So, like you brought that up, right? So are those people rearing their heads now? Are they coming more to light, or they're still staying hidden?
Well, they're coming more to light. They're coming more to light because now that everybody is home, another good thing is that there's a lot of attention in social media. More people are listening to news. More people are seeing stuff. More people now have time to kind of slow down and like, what's going on there. So every little thing is going viral. And even if it's not something you like, it's coming to your face. So a lot more people are talking about it. There are more support groups, coming up from this. And now mental health advocates, like I was, some of the interviews that I have with another mental health advocate in Jamaica, she had me on, and we're just talking about like you're talking about the effects of the pandemic. And she was talking about the alarming statistics, of domestic violence in Jamaica. And then working recently with United Nations, UNFPA, so there was a recent report about women being, it's been there, but now it's like more people are reporting it. It's like now more people are talking about it. And now that even at the national and global level, mental health is a big issue, that everybody is now hearing mental health. So for once, it's becoming kind of like normal. And it's no longer like a taboo that you're talking about mental health is staring everyone in the face. So thankfully, more people are speaking up on behalf of this population. And thankfully, some of the victims, and the survivors, they're also coming up to say more about it, which I'm happy about. I'm happy that, finally this is getting attention, just because I mean, well, maybe not just because, but also, thanks to the fact that we're all sitting at home and this is getting more.
Okay, I'm thankful. I'm thankful for that it's getting the attention it deserves. So that's good. Alrighty. So we all know things are not the same. Things have not been the same for a long time now, since the beginning of 2020. A lot of people say if we could scrap 2020, they will. I wouldn't say no. Actually, it depends on, I like to look at things empty or half full. I feel like there've been some positives and I like to hold on to that and thrive, right? So, but how there's some people that we know that I actually personally know because they've not been able to go out, or they're actually scared for their health because they may be immunocompromised or one thing or the other. So when I say immunocompromised, I mean their health, their immunity is not really strong, right? And so they are at a higher risk of getting sick. So these people, they're not able to go out, or one thing or the other, or their family members. Even you talk about the healthcare provider. Like my husband goes out, he's a healthcare provider too, leaves the home, and we're just like, oh, please don't bring home germs, kind of thing. Please don't bring home the germs. I hope you cleaned your hands, take off your shoes over there. So we all know we are more stressed. Some people are very lonely. How can we thrive in this situation? Are there actionable steps we can take to protect our sanity, kind of thing, and thrive in this situation?
Yes, they're actionable steps. They're actionable steps. And I like to put this in like three. I like to kind of number and segment my stuff. So I like to put it in, let's say, 3 ways, okay? And the first one that we all have to do is to do that self-assessment of how are we doing. Like you said, you're being, I mean, I won't scrap 2022. It's come with a lot of bad news, but it's however we want to look at it. Okay. So the first thing first is, how am I doing? Do your self-assessment. How am I feeling? Because mental health is basically about 3 things, okay? How we're feeling, our thoughts, and the way we're behaving. People can see our behavior, but nobody can see what's in our mind. Nobody can know your thoughts and really feel what you feel. So when you do that self-assessment of how am I doing? Am I stressed? Am I overwhelmed? Am I anxious? Am I happy? Am I sad? How am I really doing? And when it's actionable in the sense that I tell people, and when I've worked with clients, I say, get a pen and a paper. And I do this myself because sometimes I just find myself writing. You're just writing and thinking, and you're writing and you won't even know you had all those things in your mind. It's just like those who are authors. If you ask them, they just get the pen and the paper and they start writing. So when you do this assessment of how am I doing, identify it. I'm so stressed, I'm angry, I'm this, then why? Okay, because I lost my job, or because the kids are home now. Trust me, a lot of parents dealing with kids working from home, it's a lot of stress for them. You never knew that, having your children with you 24 hours, 7 days a week can drive you crazy, Even if it is that, you have to be sincere with yourself as to what exactly is making you feel the way you're feeling. And it doesn't have to be negative all the time. For some people, they're happy, maybe because their spouses are now home more with them and they're finding more time with their homes. What is it? So when you have the how, then ask the why, then also go to the what are the things making these things work this way. Okay, my husband has been very accommodating. Now we've been cooking together in the house, or now I'm able to call friends, or now I'm able to do that online course, or now I'm getting to relate with my children more. I actually know their weaknesses and their strengths. Now I am actually seeing them grow. When you have the how, the why, the what, then you decide what do you want to do. If everything is going okay, then you're going to say, everything is going okay. Do I need to continue something? Do I need to reinforce something? Or if it's not going okay, do I need to change something? Do I need to talk to my spouse? Do I need to restructure my house? Do I need to face something? Because you've been able to identify those things. That's where the self-assessment comes from. And, there's some things.
How often do you need to do this, the self-assessment? How often do you think people need to do this? Like weekly, daily, how?
You might have to do it several times a day.
Really?
But if yes. And I'm going to share an example with you. But
Okay.
the important one is that, for whoever's listening to us or watching this for now, and you haven't done it before, I say that do one comprehensive one. Because the thing is, if you take time to do a comprehensive, full, detailed one, it puts a lot of things in perspective for you. So it will be easy, because because I'm saying it as what, how, this, it doesn't mean that it will be that, structured. A lot of times it's in the moment that you're thinking how you're doing. Let me share an example with you. On Monday, something happened. There was a mix up or something with my parents' flight itinerary. And it got me, because you already have plans, expectations, everything in place. And just with a one phone call, everything changed. Okay. It got me really, really upset. But because I've done this assessment right from the time the pandemic hit, I did a comprehensive assessment. I had to have some conversations with my spouse. Now we had to get some things together. That's been helpful. So everybody is doing their own. And because when you identify your action points, which, that was when you asked the question, when you identify the action points, it might be having a discussion with the people around you, and so that you can give yourself time when you need time. You can identify when somebody needs to do something. You can know when you need to step in to help someone or when you need to take a break, and everybody would understand. That's why that first comprehensive one is okay. So anyway, back to my story. I was so upset this morning, and I was the one that was supposed to, because online schooling has started. I was so upset. I found myself snapping at my spouse, okay? Because I just didn't know what to do. I was overwhelmed. I wasn't the only one feeling that way, but I think a lot of the responsibility was on me. So what I did, I told my husband, please, you have to step in and take care of the kids this morning. Thankfully, it wasn't like there was an appointment he would be missing. And I drove out of the house. I did an assessment. I'm overwhelmed right now. Why? Because of this itinerary change, it's changing things for everyone. Okay, what can I do? I need to make some phone calls, do some things, but how am I feeling right now? Very upset. If I do not do something, it can escalate. So I drove out of the house. Some of the things that helped me is music. Depending on my mood, music will help me. Sometimes I need very high tempo, dancing music. Sometimes I need slow ones just to do some reflections. So I drove out of the house. I turned on my music, Thanksgiving music, and just dance. I drove to the coffee shop. I would normally not queue. It was such a long queue, but because I needed some time to cool off anyway, I stayed on the queue, and then I made some phone calls. I was talking, and I even got teary at some point, but I called my siblings and we sorted things out. By the time I got back home, they were busy. And guess what? Now I have the energy, but they were in school mode. So I started cleaning my room, and I changed some things around, and I used that energy to do something. So that day I had to reassess. By the afternoon, I was feeling better, like, okay, what's going on? Okay, let me do some cooking. So sometimes we have to do it, and we just need to know that everything starts with you, because whatever is going on with you would affect your whole environment. So that's why how often you do it depends on how well you master this. But you have to know that you need that assessment. You need that self-assessment first. After the self-assessment, we need to reframe, okay? With this pandemic, we're all seeing and magnifying the crisis part of it. Reframing this can help us. With this COVID or with this pandemic, a lot of people have been able to see maybe you lost your job. Let's take that for example. You need to see, hey, maybe there's something in me that I'm not paying attention to. Now that I've lost my job, look inward and see, what is it that I have? What is it that I haven't done? So let's see opportunity in this, the whole pandemic thing, then reframe and, nurture that. Let's not just see it as a crisis. It might just be an opportunity for you, because even history has shown that, during pandemics and depression, a lot of successful, wealthy people came out from that situation. If it didn't happen, they probably wouldn't be known today. That might be the same for you. So we need to do a lot of reframing. And with the reframing, we see the opportunities and we move on from there. Another thing we need to do is to use technology wisely. So self-assessment, reframing, and wise usage of technology. That's when it comes to you know, only, you know, tune into verifiable sources. If you're going to be getting your information from CDC, if you're going to be getting your information from World Health Organization, just have a source that you listen to. Don't change channels to see, hey, what's the data here? How many people died here? How many people, you know, don't just feed in on all this.
It
And then
stresses
there's
you out,
influx.
though. Actually, I don't like listening to it. It like affects my mental health, and I'm like, no, I just need the summary. I don't need to know. Seriously, you need to
You
know
see,
yourself.
you see, if that works for you, because there's some people like me too. I just rely on, you know, my dad listens to the news a lot. My
My
husband,
mom,
you know, he
my
has
mom listens. She comes to tell me.
yes, just tell me the important part. You know, I don't want to get all that because it overwhelms me. So when you know yourself, you know, just build, and that's part of the self-assessment I was just talking about. You really need to know yourself so that you know what triggers you, you know what calms you down, and then you're able to communicate that with people around you. And you also know how you can support the people around you. It will just make the environment better, because now we need ourselves more than ever. So with that information, and then there should be time for us to tune off too, because now everybody's getting zoomed out, like they say. We're all on Zoom, we're all doing virtual this, virtual that, a lot of screen time, a lot of us are working from home. You know, the communication with our family members is, even because people are working from home, there's a tendency that you work more hours than you will do at work. So people are not tuning off work, and the relationship at home with your family is, you know, not that well, because everybody's on the phone or on the game or something. So we need to do all those. So those three things I think will help: self-assessment, reframing the situation, and, you know, using your technology wisely so that we don't get overwhelmed. I think they're practical.
Yeah, very good, very good. I actually just wanted to tell a story. I've worked from home for like 4 years now. So, but you know, the kids were not always home. So I used to be quiet. And when they'd be on some holiday, I was just like, stop making noise. Like, ah, patient's calling me, blah, blah, blah. And then I was like, okay, how long am I going to keep screaming like this? So, like you said, you have to refrain. And I just thought,
Yeah.
you know, I need to change my orientation and accept that the COVID is here to stay. And so what do? I actually at work they gave us the opportunity to get some sound, something to block out the noise. So it's like it
Yes.
plays like some beautiful, just calming sounds, and I don't hear them at all. So you just sometimes you just need to change. I hear
Yeah.
them once in a while, right? But just no. But that's if I want to step out of my office while I'm working or whatever to pay attention to them. Thankfully, I have somebody else watching them. But you, for your sanity, because I was just laughing. I'm like, seriously, I used to scream all this. I started making noise. You want me to get fired? Blah, blah, blah. I'm like, how long am I going to
Yeah.
do this for? I need to
Yeah.
find something that works for me. And I just don't hear them. And people can make like, oh, okay. When I am ready, I come out, check on them. How are you doing? Blah, blah, blah. School, what can I help you with? And then I go back to do my thing. So just finding a balance, finding what works for you, because
What
if you
works for
continue
you?
to scream, you're going to just be giving yourself headache and high blood
Exactly.
pressure, so which you don't
Yeah.
need.
So
So,
so talking about that, for what the example you gave, that's a good example that's bringing another issue that I'll quickly touch upon, which is the children. It's really not easy on the kids as well, because a lot of things,
true.
and they're watching the news, they're seeing what is happening. And, you know, on different platforms, I told people, please let's not just assume we're the only one getting overwhelmed with all these things. So, and seeing the opportunity, when I talk of reframing, they're home now, and a lot of these children, they have gifts, they have talent to do a lot of things that we as parents would not even know, because they're spending a lot of time in school. So I tell people, you know, part of that first assessment, we also need to ask them, what do they think about COVID? Like, you know, my kids would tell you, oh, COVID started in this country and this, I want to be a scientist so that I can end COVID, or, you know, this. So while we are reframing things and working for ourselves, let's also put it on them to say, what is it you enjoy doing? We now have a lot of artworks in my house now, because the kids just paint. Whoever likes to record, let them record themselves talking, being a journalist, or whatever they want to do. So we should really pay attention to them and reframe things to see, let's just see the positive in this and know that it's just a temporary thing.
Sure. Yes, I do know that I have one teenager that is very anxious. She's very anxious, like, oh, what if we go out and we get, and I'm like, sweetie, Yes, we do what we need to do, wash our hands, and it's all left to chance, right? You do your best, and the left you can't control everything, right? And you need to live life. It's the whole thing about being sane and maintaining your sanity, right? So, yes, thank you so much. Awesome. This was a good conversation, and I believe people will benefit from this. And actually, acknowledging loneliness. First of all, like being able to acknowledge something is the first step to healing, right? Right? Being able to acknowledge that, yes, this is going on and it's okay. And what can I do about it now? And she just told us one, oh gosh, my head. One, you have to self-assessment. The second one I remember, reframe, right? Self-assessment, reframe. And then the third one was, gosh.
Wise usage of technology.
Wise usage of technology. Alrighty, so we said that. So we've talked about a couple of things today. What thing do you want to make sure that people get out of this, even if they kind of glossed over everything?
Well, one thing I want everyone to know is that your mental health matters. And, you know, it sounds simple. And because you are a medical person, you are in the healthcare profession, I want you, even you, to listen to me more. Because, see, for us, mental health or healthcare professionals, we often, most times think that healthcare is for people outside. When we think of healthcare, we're thinking of our patients. When we think of healthcare, we're thinking of others. It's almost like we are fine, we are secured. No. So when I say we need to know that our mental health matters, that means I'm saying, Dayo, your mental health matters. And if you are not okay, it's going to affect everything around me, my relationship. It's going to affect my work. It's going to affect my relationship with my patients. It's going to affect my home. It's going to affect my marriage. It starts with me, because it just has to start from within so that we're able to, you know, behave the right way. And then if everything is not okay, then we're able to seek help for ourselves too. So I have this model. I think I have a useful tool for your audience. I can share the link with you. It can help with self-assessment. For them to download it, it gives you clarity. If you take time to answer it and do that first assessment, it's going to help. And then the first thing on that blueprint is pause. Like, wait, let the whole world stop right now. And like, what? Why are we stopping? Yeah, so that you ask yourself, how am I doing? When we can start with ourselves, then we're able to help everyone. Like I told you, the 4 groups, a lot of medical professionals, a lot of frontline workers are going through a lot of stress. But when we're talking of mental health, we're talking of the general population. When we're talking of mental health, we're talking of, hey, there are medical professional here to help you. You can call your counselor, you can call your psychiatrist, you can call your nurse practitioner. Guess what? We are also getting overwhelmed. Okay, and oh, what is going on? I really can't deal with work. I need to call my boss and tell him I'm not coming up today. I need to let the management of my organization need to do this. Wait a minute. Do you know these people making all these decisions at the state level, at the national level, at the home level, in the homes? You know, they are human beings too. So all those people, while they're making all the policies and while we're making sure that we don't miss the shift, while you're answering your patients' calls and you're trying to say, hey, kids, don't let me lose my job. Can you keep it down? While you're doing all those things, do you know that you need to take a moment and see, hey, how am I doing? You know, leaders everywhere, healthcare or not, frontliner or not, husband or wife, you know, teenager or not, our mental health, everyone's mental health really matters. That's what I want everybody to know today. So when we're talking of statistics, when we're talking of this increasing or that increasing, we can talk about it from now till tomorrow. Google can give all of us that. What the internet cannot give us is to tell us how we are doing. We only get the result from what we want to know from the internet. So if you're not searching for calming skills, if you're not searching for, like, you know, right now I started doing meditation or, you know, listening to meditation apps on my way to work. You know, before it used to be something you just be telling your patients, hey, you can try yoga, you can try meditation. Okay, take a deep breath, make sure you're breathing in and out. It's like the only time you do that is when you're telling your patient. Ask a lot of medical professionals or mental health professionals, when do you do this thing other than when you're telling someone else to use the tool? So if there's anything I want everybody to know, if this is the only thing you will remember here, know that your mental health matters. That's it.
So you said that you talked about like sharing like an assessment with the audience. And so, well, how can people get a hold of you and also get their hands on that assessment?
I'll share the link with you so you can put it there for people to just go on, and it would send the work to them. But you have to do the work. You have to pen this thing down. Get a pen, get a paper, get to work. Once you do it that first time, it puts a lot of things in perspective for you. So I'll share the link with you and you can share with your audience. Where can they find me? So part of reframing and seeing opportunities in the pandemic was I decided, you know what, I'm going to talk more about mental health on social media platforms and just make good use of it because everybody is on social media. So I created a group called My Mental Health Matters. So that group, they can find it, and please join. And I encourage people not just to join, but to invite their friends and family, because we're talking about things from personality disorders to specific issues. So that if you, and I challenge everyone again, your mental health matters. So when we're talking here, don't be thinking of your crazy neighbor. Don't be thinking of your stubborn sibling. Don't be thinking of, oh, I know somebody that fits this criteria. Always start with you first. Then we're able to help our families. Then when we go outside, we're able to help people. So join the group. And then I also have on Instagram, I have Mental Health for Me. That's my handle. You know, I share information there to like tips that can help people on a daily basis. And then I have DioSpeaks, my email, diospeaks@gmail.com. You can reach me there. And that's especially for those who want to help their employees or their organizations to be able to focus on mental health. And again, you will know my model is with you first. So it's always starting with the leaders first. Once you get it, you're able to help people. So those are the places they can find me.
Absolutely, absolutely. All right. Hopefully we will be contacting you one day. So, because we all need it, right? So thank you so much. It was a pleasure having you on here today. And I learned a couple of things, and I hope to be able to implement it in my life too. So I hope you can do that too. You all have a wonderful week, and I'll see you in the next episode. Bye. Nice.
Bye. Thanks for having me.
All right. Bye-bye.
Bye.
Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.